The ANITA trial was a randomized phase III trial that explored the incorporation of atezolizumab to standard therapy with platinum-based chemotherapy followed by niraparib in platinum-sensitive recurrent ovarian cancer. Unfortunately, the study didn't find any significant efficacy of adding atezolizumab, but we have many exploratory objectives, including biomarker research. One of the exploratory objectives was to figure out if a baseline plasma proteins could predict in somehow or the benefit or even the prognosis in this study. And what we performed was a multiplexing immunoassay of 74 proteins covering essentially proteins related to immune modulation, angiogenesis, as well as apoptosis. We have done a univariate analysis first, and then a second step was a multivariate Cox regression analysis looking for an overall survival modeling using a 10-fold cross-validation. What we find is that there are 4 proteins associated with worse prognosis in terms of progression-free survival and overall survival that were VISTA, CD31, VEGF-A, and also UPAR. And on top of that, LOX1 was also associated with a worse overall survival. Then we integrate these proteins along with other clinical factors in our multivariable Cox regression model. We did a 10-fold cross-validation. That means that only those markers that were consistently predictive of prognosis in at least 6-fold were selected for our final overall survival model. Our final overall survival model was highly predictive of overall survival with a C-index of 0.69, and especially it was very predictive at 6 months with a AUC of 0.87. It is remarkable that we have identified VISTA B7H5 as the most relevant prognostic factor. And indeed, when we have analyzed the quartiles of the expression and we have classified by quartiles and correlated that expression with the outcome of the patients, we saw that the patients with the highest expression of VISTA B7H5 in the 4th quintile had a much worse prognosis compared with the others. Indeed, at 6, 12, and 24 months, there was a huge difference with overall survival. So in summary, I think that we can conclude that there are 2 important proteins associated with a bad prognosis in this population. One is VISTA, B7H5, the other is VEGF-A. I think that this information could be used for future designs of research in this setting. And we are now in the process of validating our OS modeling as well as these findings in other independent cohorts. But it is remarkable that in this academic study, we were able to have access to the sample of the patients and to provide this important information for the community.